So you want to talk to your wife about menopause? That's awesome. Good for you. You should. And guess what? It's going to be hard to do. And the reason is that she actually didn't talk to her mom about menopause. She didn't talk to her friends about menopause. She barely understands what's happening to herself by women's own admission. They did not talk to their moms about this. They were not prepared for this. And their doctors are actually not trained to support them on menopause. Leading experts in the field today got 2 hours, maybe 6 hours of training in all of med school on menopause. And menopause is affecting 1 billion women today. 20% have clinically depressive symptoms. 1 in 10 even have suicidal thoughts, mood swings, weight gain, joint pain, insomnia, brain fog, memory loss. And then you have to sit down and have a conversation with her? It's fair that you think that that's going to be hard to do. There's a couple ways you could do it though. Number one, I would start to look into menopause. Don't sit down and throw it all at her like, you explain to me everything that's going on with you. What I would do is I would educate myself a little bit about it. You could watch a lot of stuff. Pick somebody you trust. Don't try to watch everybody. Stick with somebody. You could watch my TikTok channel, The Parent Express. You could watch this channel. There's a lot of options. You can listen to podcasts. You can read books. You can do whatever. You don't have to be an expert. In fact, don't be an expert. You don't need to be an expert, but you need to have at least spent some time looking into what is this about? What is she going through? Why is it happening? And what can you possibly do about it? Well, the answer is not much. You're not going to be able to fix her. You're not going to be able to make these symptoms go away. You're not going to be able to fix her frozen shoulder or make her sleep better. But there are things you can do to support her. And in order to do that, you have to have a decent idea of what's going on. Dr. Mary Claire Haver, maybe start there. You like Dax Shepard? She was on the Dax Shepard podcast. She's been on many others. Check her out there. You just need to spend an hour and you're going to be fine. So then it comes to sitting down with her. And I would pick your time. You know, sometime when you guys are both relaxed, sometime when the kids aren't going nuts, sometime when you're not about to go to sleep, you know, pour a drink if you drink. Whatever relaxation is to you, that's probably a good time. And this isn't going to be something where you're going to convince her to go do something. You may read about or hear about HRT. Don't go tell her to take HRT. That's hormone replacement therapy. If she wants to do that, she can, and she knows she can, and she'll talk to her doctor about it. But what I would do is I would sit down and I would take this stance. And it's called F.B.I, Feeling, Behavior, Impact. And if there's things that she's doing that are hard for you, or confusing, or scary, then what you can say is, when you lash out at me, right? One of those rage episodes, for example. When you lash out at me, it makes me feel, that's the F part, it makes me feel like you don't love me anymore. And if you don't want to be that dramatic, it makes me feel like you don't want to be around me in the house, or, you know, I don't feel as comfortable with you. And my concern is if that behavior, B, continues, the impact, I, will be that we're going to stop communicating, that we're going to drift apart, that I'm not going to be able to support you in these things that you're going through. F.B.I, Feeling, Behavior, Impact. Why does this work? It works because it's hard to argue with feelings. It's hard to attack feelings. It's just because that's how you feel, right? Or that's how somebody else feels. You can't say they're wrong, it's how they feel. What happens when you start to make decrees like, you need to stop doing this because it's going to cause this? Well, that's a different story. That's where you're going to get in trouble. That's probably why 60% of divorces happen during the menopause years, between ages of 40 and 60 for women, and even 73% of women blame menopause, or at least attribute menopause. Not maybe entirely, but they'll attribute menopause to a cause or one of the causes of their divorce. F.B.I, feeling, behavior, impact. Let her know, don't tell her what she's doing wrong. Let her know how what she's doing makes you feel. And then just stop talking and let her answer you. And if for any reason she is aggressive, if she's upset or whatever, do it again. When you lash out at me or when you talk to me like this, it makes me feel like I can't trust you. It makes me feel like I'm not your partner. And if that behavior, and you don't have to use the word behavior, you could say, and if that continues, the impact's going to be, we're not going to be able to communicate anymore. And then you stop talking again. And this is supposed to be disarming. You're trying to get to a mutually beneficial outcome, but you're also doing it in a way where you're trying to understand where she's coming from. Because what you have to get to is the point where she's willing to talk to you about what she's going through and how hard this is. And you don't need to say, well, guess what? I read about this, so I know you're dealing with that, and it's because you're losing estrogen and progesterone. You don't have to get into all that stuff. If she says she's got hot flashes and you happen to have learned that that's because estrogen's declining, affecting the area of the brain that regulates temperature, that's fine. What you need to know, though, is that hot flashes are real and that they're hard. So when she tells you those are bothering her, have a conversation about what you could do about it. I've heard of husbands putting fans, buying fans and putting them in the bedroom by her side. I've heard of husbands definitely keeping the thermostat lower. Do what you can. Do what you can to help. And if she tells you she's in pain, know that the first doctor or the second or the third might not be the doctor that actually helps her out. Because women often go through 5, 6, 7 doctors before they find one that actually will talk to them about the real problem, which is hormones. And they'll oftentimes get gaslit. They'll be told they're getting old. Go have a glass of wine, relax. Go see like 6 specialists for all of this crap. And none of it is actually addressing the problem. So just know that that's probably going to be her journey. So when she comes home from doctor 1 or 2 or 3 and doesn't have an answer or isn't feeling better, be patient. Know that these things that are happening to her are hormonal changes, physiological changes affecting her body, affecting her brain. It's nothing she wanted. It's nothing she asked for. It's nothing she was prepared for. But it is something that she has to go through, and she has no choice. And she needs you to educate yourself about it so that you can show up and support her.